Good morning, friends. Hope you're enjoying this wonderful Sunday morning. Do you know before COVID, 70% of the global deaths are due to non communicable disease, and lack of physical exercise or the activity is one of the key risk factor. That is going to be the thought of the day. Welcome to Live Long Hub. I am Jay Kumar, wellness coach with the mission of bringing the fitter version of ourselves. Let's deep dive into today's topic of key risk factors of non-communicable diseases and how we can work towards solving the epidemic of physical inactivity. As per CDC, Center for Disease Control, there are four key risk factors for chronic disease, which is basically the non-communicable disease. The first is insufficient physical activity. Second is the tobacco use. Third is poor nutrition. And fourth is excessive alcohol use. And as I told you before, the non-communicable disease deaths are close to 71%, which is almost like 41 million. And do you know that the top deaths are due to the cardiovascular disease, cancer, diabetes, and chronic respiratory diseases? And do you know that the cardiorespiratory fitness is one of the major risk factor among the obesity, cancer, or the diabetes? And in the survey, it is found a person with a better cardiorespiratory fitness. It is like the mean plus twice of the standard deviation. So those individuals are having the lesser mortality rate, and also this study is being extended to the older individuals above 70 and also people who have hypertension. So it is found that they have very less mortality rate. And now we will just get into the uh, more discussion on the physical activity. The World Health Organization has done 358 surveys in 168 countries, and the findings are basically like what they have seen is like it's only like 1% improvement in 2016 of people who are doing a physical activity. And if you just split it into the two segments like higher income countries and lower income countries, the problem is seen in the higher income countries, which is almost double. 36.8% of people are not doing any physical activity at all, and this is like 5% increase compared to 2001. So in every 15 years what they see is like there is a 5% increase in people who are not doing any physical activity. So in 2018, what US government did is they established physical activity guidelines, which is basically a global action plan, and the objective is to improve on the cardiorespiratory fitness, muscular fitness, bone strength, balance, and flexibility. So basically, they formed a activity task force, and their prescription is in 2035. Basically, there is a target of they want to improve 50% of Americans to achieve recommended levels of physical activity. And do you know what is the current scenario in India? There is no formal education nor practical experience in designing and learning the exercise program. And you know, the physicians like they prescribe patients to do exercise, but they are not giving any instruction on how to do exercise. And this is where the ACE certified personal trainers is going to support. So basically how they can do this is, one, they can design and implement effective exercise program. Second, they can coach clear clients on basically bringing behavioral changes in terms of health. And you know this, the personal trainers were initially focusing only on the fitness enthusiast, and now if you see every child to adult, they are obese, having higher weight, and this is basically due to insufficient physical activity. So this is where the trainer is going to support, and I vouch for you opting for a personal trainer to support in your fitness journey. And I've also made a ebook which is on 6 steps for weight loss, and also which basically helped me in physical transformation, or how I reduced my weight by 13 kg. So you can see the link in the comments, and please go through and then let me know how it is supporting you, and let me know if there are any queries. And if you are not subscribed to my channel, please subscribe and do like. I will be posting more videos on this. Thank you so much.